Welcome to Empowered Health. This week we have an amazing lineup of stories with information to help you empower your health.
That's right, we are going to be hearing about an important new diagnostic tool, motion x-rays, and we are going to introduce you to Ferroblock cloth.
Right now, let's watch the inspiring story of Norris Morgan.
It started early July 2009. We were on our sailboat in the Gulf Islands, and we were going for a hike in Ruxton Island, and about a mile along, I started feeling this shooting pain shooting down my right leg, and I thought I was having a heart attack.
Thankfully, it wasn't. What Norris was experiencing was back pain. Through his doctor, he was referred to a specialist who tried but could not make the pain go away.
Pills didn't work, the anti-inflammatories didn't work, and by February I probably had the first cortisone injection, and it definitely helped. But the pain that I was having shooting down my leg was, out of 10, it was easily 8, and I might want to even say 9.
Next, he tried the surgical route, opting for a laminectomy, an operation to open the spine where the nerves were being aggravated.
I decided to go for it because of the pain I was in. And then I had a 6-week recuperation period, at least 4 weeks before I got back to the office. But literally the next day or the day after, when I was then supposed to walk 100 yards and stuff like that, there it was going back down my leg.
Determined, Norris continued to look at his options. And then, after a failed attempt at physiotherapy, he discovered deep tissue massage therapy.
Primarily, I would practice a technique called systemic deep tissue therapy. And what that is the systemic means is I'm looking at the body as a whole, and the deep tissue, I'm using primarily my elbows, my knuckles, and my fists to treat, to get to the depths that we need to.
And I'd say for 3 weeks, there wasn't any difference. And maybe the third or fourth time, I said, you know what, Tanya? I'm not sure. I think maybe I feel something different. Well, then we just hit Christmas. We all were off for Christmas, and then I got back at it in January, and by April, I was a new man.
Norris was a perfect example of massage. I mean, he wasn't getting great results from the avenues that he was taking, and short of begging him to stick with a treatment plan, we basically just worked through the scar tissue that had developed in his body through the years, and then the scar tissue that developed from the surgery. And just by essentially breaking down those fibers and allowing the body to really heal itself. And that's what massage does. I'm facilitating the body to allow to heal itself.
Tanya eventually recommended that Norris add yoga to his treatment plan. And this turned out to be the final frontier.
I will never know whether it was purely the deep tissue massage that did it. The yoga has strengthened it. But I was clearly a new man before I'd ever tried the yoga. But I can't say that it wasn't a combination of that operation together with it. I'll just simply never know. And I don't really care. My back is better now than I've ever had it in my life.
Coming up on Empowered Health.
Food is everywhere. Food ads are everywhere. And the need to feed can be fueled by the slightest hunger pang.
You're watching Empowered Health. Weight loss is often on our minds, and one thing a lot of nutritionists recommend is smaller meals or grazing throughout the day.
Randy Shore is back to talk about the idea of hunger and fasting. Randy?
When was the last time you were hungry? Food is everywhere. Food ads are everywhere. And the need to feed can be fueled by the slightest hunger pang. For a lot of us, eating isn't so much dining as it is grazing, snacking all day long. A lot of fitness and nutrition consultants have even promoted the idea of grazing through the day, eating smaller meals supplemented by snacks as a way to lose weight. They told us that eating all the time in a healthy way would stabilize the insulin levels in our blood and avoid the big surges of insulin that come when we eat a big meal. Constantly replenishing your supply of energy and avoiding the so-called insulin crashes does sound pretty reasonable on the face of it. And I think if you're an aerobics instructor, it would probably be just fine. But the grazing diet and by extension our all-day snacking lifestyle fails to take into account is that hunger is okay. In fact, hunger is more than okay. It's essential. When you eat, your body produces insulin, which helps replenish the energy in your muscles. It also causes fat cells and your liver to absorb excess energy in your bloodstream. So far, so good. A few hours after eating, your insulin levels start to fall. Low insulin causes your fat cells in your liver to release energy. Snacking short-circuits the fat-burning process right before it gets underway by bumping up your insulin levels. You can see the problem. Hunger is a pretty strong indicator that your fat cells have changed gears, and a few extra hours between meals might give them a chance to do vital work, burning energy. These are massively complex biological processes, so I want you to treat individual studies that appear to have implications for obesity or fat loss with extreme skepticism. That said, there are a couple of recent studies that are really interesting. At UBC, mice bred to maintain a low insulin state even after eating were able to eat a high-fat, high-calorie diet and stay thin. It appears they couldn't get fat no matter what they ate, not without the normal surge in insulin. In a second study at the Salk Institute in California, mice were divided into two groups, both on a high-fat, high-calorie diet. One group was allowed to graze 24 hours a day, while the second group ate the same amount of food in just 8 hours, followed by a 16-hour fast. Same amount of food, but very different feeding schedules. The grazing mice became obese and suffered from all kinds of health issues, including liver disease. The feed and fast mice stayed slim and were actually more athletic than normal mice. It might just be that the time between meals is as important as how much you eat when it comes to obesity, at least in mice. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Sasha Blaskovich, who works with X-ray and motion to help explain and solve uncommon neck and head problems.
Well, my initial personal whiplash led me to it. I was living with my whiplash for about 7 years before I discovered that the technology existed.
The IT he's talking about is X-ray fluoroscopy, an extraordinary diagnostic tool that generates a picture from X-ray of the neck. It's a combination of traditional fluoroscopy and X-ray technology.
Well, there's a lot of people walking around with 10, 15, 20 years of chronic headaches, chronic neck pain that MRIs have not shown what's wrong with them, CT scans have not shown what's wrong with them, because their anatomy is perfectly fine as far as the bones. They have the same number of bones that you and I do. They get misplaced once they start moving, and once they start moving, that's when the nerves get pinched off and function starts to decrease, and that's where our symptoms come from. So being able to diagnose somebody in those particular motions that are causing these problems is essential.
So how does it work? What exactly does this type of scan reveal, and how does it affect diagnosis?
Basically, we take them through all the possible ranges of motion that their neck can do, so front, back, side to side, rotation, and based on that information, we can see if two adjacent bones are moving excessively relative to the others, A, and B, the two abnormally moving bones. What I do is actually measure them. I have a millimeter scale that I use and software that I use to be able to actually grade and measure how far they're moving.
Motion X-ray is an extremely important diagnostic tool and can even be useful prior to injury.
If they're not injured, this is something that is of essence to them, because statistics will show that 20% of the population will get into a car accident at some point in the time. Mm-hmm. And for people to know that having a baseline scan prior to an injury is essential to battling that injury legally.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Hey guys, this is your Simple Fitness Tips. My name is Jameson Wolf, and this is Simona Marion. Today we're going to show you how to perform and progress balance exercises. Balance is an often overlooked part of overall fitness. Having good balance means you will less likely suffer an injury from a fall, and this can be vital, especially for elderly. Now Simona, I'm going to get you to start with a one-legged anterior reach. Notice how she's going to place her hands on her hips and engage her core. Both knees are bent and she's reaching forward with her toe. Good. As she progresses, she can move on to different patterns such as bringing it to the side. Good. Or behind. As she gets good at that, she can go ahead and move on to what's called a one-legged squat touchdown. Great. She's going to use the same side hand as the leg that she's squatting on. Good. Once she masters this, you can move on to one-legged squats or different lunge patterns. Great. Put this at the end of your workouts. All right, see you next episode.
After the break.
Studies have shown that diets that are high in foods that have a high glycemic index can cause damage in terms of cataracts and macular degeneration.
He had an injury in his leg, which what we thought was an injury, and through a few different diagnoses, we finally were diagnosed with a bone cancer in his right hind leg. And we weren't really given any other option other than to just kind of put him on pain meds and see how long he survived.
Sorry, but that wasn't good enough for Kendra. As you can see, she loves her dog Riker. She knew where the cancer was, and because Riker's health was declining rapidly, Kendra acted. She sought out alternative opinions and decided to save his life, but not his leg. But it doesn't end there.
He was experiencing a lot of pain after surgery. There was a lot of swelling and fluid buildup underneath everything that happened. So he had to go in for a second surgery, and we're 2 days after that now.
Here we see Riker 2 days post-op. He's uncomfortable, he's listless, and he's been refusing water. His breathing is shallow and rapid, suggesting he's in pain. Kendra sought out an alternative to pain medication, the sort that simply numbs the senses. She's applied a fabric known as Ferroblock. Riker's response to the cloth was immediately.
He got a little bit of personality back right away, immediately when that went on. He's a really needy dog when he loves attention. He normally kind of headbutts you or grabs you with a paw if he's not getting enough, and he's not really been doing much of that lately, and he did that within a minute of the Ferroblock being on to both of us. So,
by wrapping the painful area with a layer of Ferroblock fabric, you shield the body from some types of electromagnetic fields which can cause irritation to nerve endings. Now normally, your body tissue protects you from electromagnetic fields. So in the case of injury or when nerve endings become exposed, Ferroblock serves as a protective shield. It has been successfully used to treat amputee phantom pain, arthritic pain, fibromyalgia, sports injuries, and muscle soreness. And as you can see, it can be used on anyone, even dogs.
I was curious to see if it was going to work or not, and see if we would notice a difference, because I didn't really know. So I'm impressed. I'm impressed that I actually noticed a difference.
I looked at a lot of research or science papers that were geared towards what's that link between eye health and nutrition. So there's hundreds and hundreds of science studies that show that link.
Let's take a look at what some of those studies have uncovered about the role of nutrition in common eye diseases.
Studies have shown that diets that are high in foods that have a high glycemic index, such as refined flours, sugar, etc., can cause damage in terms of cataracts and macular degeneration.
A cataract is what happens when the lens loses its transparency. It's a condition that most people over 60 experience. But did you know that diets rich in antioxidants and omega-3 fatty acids found in cold water fish can decrease the risk of certain cataracts?
Diets that are high in saturated fats can be detrimental for cardiovascular health. And when we've researched the link between various health problems with eye health, we noticed that cardiovascular health and eye health have a lot of similarities. So avoiding lots of saturated fats is a good idea.
Obesity and heart disease are risk factors for age-related macular degeneration. But here's the good news. Studies have shown again omega-3 fatty acids, supplements with specific antioxidants, and zinc decrease the risk of macular degeneration in some patients by as much as 25%. For something like dry eye syndrome, flaxseed oil and diets with a low omega-6 to omega-3 ratio are recommended for control and prevention.
No foods are going to prevent you from needing to wear glasses. Let's make that very clear. You're not going to see more lines of letters necessarily at the eye doctors, but those pigments, as well as they protect, they also filter the light.
Remember, each person is different and eye disease doesn't always present the same for everyone. That's why it's important to get your eyes checked regularly. Coming up on Empowered Health.
What we've got today is we're going to take some vegetables and we're going to marinate them and we're going to put them on the barbecue.
This cooking and nutrition portion brought to you by Save On Foods.
We got registered holistic nutritionist Julia Alton with us with another great recipe on Empowered Health. Julia, welcome to the show.
Thank you for having me. What we've got today is we're going to take some vegetables and we're going to marinate them and we're going to put them on the barbecue. So this is olive oil, quarter cup of olive oil.
Okay.
And this is vermouth, but for those who don't wish to use vermouth, we can substitute rice wine will work, rice wine vinegar.
All right.
We need to put a couple of cloves of garlic in here.
Okay, just for
and
extra bit of flavor.
some brown sugar.
Okay.
Perfect. And then a little bit of hot sauce and a little bit of salt.
And that's hot sauce.
And this is hot sauce. How hot would you like it?
I can handle some spice.
Can you handle some heat?
Oh, yes.
Okay. So we just stir this up, and this is your marinade.
All right.
And then whatever vegetables you want to use. For us today, we're using zucchini.
Asparagus.
Thank you. Onions, some
Right.
peppers, and mushrooms and tomatoes.
Right.
And so we're just going to chop some of these up and put them in our bowl
Okay.
and have them absorb the flavors for the
Right.
next half an hour or so, and then we're going to come back
Right.
and put them on a skewer and onto the barbecue here behind us.
Perfect. Okay.
So we don't want to make it too thin because you need to be able to have the skewer go through it without splitting the vegetable.
Right, exactly. So the thickness is very important.
You just want to poke it through the center of the vegetable.
Right.
And you just build your own.
Mm-hmm.
You know, the kids can have fun making their own. We put a tomato on here.
Right.
And all the way through to the end.
All right.
So there we go. So once they've marinated, this is kind of an idea of how you would put your skewer together.
And how long do they stay on the barbecue
And
for?
on the barbecue, you just have to, it depends on what kind of vegetables you've selected.
Right.
Generally, they take 5 minutes maybe to barbecue. What you don't want is to get them all charred.
Right.
When you're done with the barbecuing side of it, and probably I will put this down to just heat it up faster, I'd serve it with a plate of rice.
Right.
And sprinkle it with a little bit of sesame seeds, and
Right.
you'd have a nice vegetarian meal.
Mm-hmm. And this is actually really good for a side dish, for any
It could be a side dish to anything you're barbecuing. Yeah.
So the skewers are ready.
Yes.
And they stayed on the barbecue for about 5 minutes.
5 minutes, 5 to 7.
And they're ready to be served with brown rice.
Yes.
Okay, well, Julia, thank you for being on the show and showing us this recipe. And you can find out more about this on our website and keep watching Empowered Health. It's barbecue season and I've got registered dietitian Crystal Higgins with me to give us some ideas about how we can make those barbecue dishes even more flavorful. Crystal, welcome to Empowered Health.
Thank you.
You know what, as the heat begins to rise up, I get really excited because I can get back to barbecuing.
Yes, me too. Now, I have a question for you. When you think about using the barbecue, what comes to mind?
Chicken, and some more chicken.
Sounds like VJ likes his chicken.
I sure do.
Well, just like VJ, a lot of other people tend to associate the barbecue with animal proteins or processed deli meats, things like sausages or hot dogs, but it can also be a great tool for cooking things like vegetables. And using things like peppers, zucchini, asparagus, and putting it together on a bamboo skewer. Now the thing with that is you want to make sure you soak it in water because otherwise it may catch on flame. So you want to soak it for about 20 minutes before threading your vegetables through.
The skewer?
Yes.
Okay, that is key, important to remember. How would you flavor the veggies?
Well, the vegetables can be put into a homemade marinade or a store-bought variety, but making it at home is the best way to control the calorie and the sodium content. So mixing together a base with olive oil or sesame oil, a light soy sauce, maybe some balsamic vinegar, garlic, ginger, some honey or brown sugar to flavor it up a little bit, and marinating it for maybe half an hour before putting it on the barbecue.
Those are interesting ideas, sound really tempting. Now, a lot of people have a question that when you barbecue foods, does it affect the nutritional value, or what are the things to be mindful of?
Right. When you are barbecuing your vegetables, it's actually a very flavorful, low-fat option. And as long as it's not heavily cooked or charred, it's a great way to preserve the vitamin content of the vegetables because you're cooking it at such a high heat for a short period of time.
Okay, Crystal, I really want to work on my chicken obsession. What other foods can be barbecued?
One of my personal favorites would be yams or sweet potatoes. Those are absolutely delicious on the barbecue. You can get very creative with fruit, things like watermelon, peaches, nectarines, and maybe one thing to try this year might be grilled romaine lettuce. Who knew that you could actually make a Caesar salad on the barbecue?
Fantastic, Crystal. You've given some great ideas, and I'm going to try every single one of them. And I'm sure this year's barbecue season is going to be a lot more flavorful for me.
Fabulous.
Thanks for being on the show.
Thank you.
Well, that's all for this episode of Empowered Health. We had some great items. That motion x-ray Dr. Blaskovich introduced us to was very impressive.
It was, Michelle. And I strongly recommend the grilled veggies recipe that Julia introduced us to. The marinade was so good.
Be sure to follow us on Twitter or visit our website to learn more about the stories you saw today. We'll see you next time.
Bye.
Bye.